Blind man told police officers, afade mimi sijawahi ona bangi maisha yangu yote.
Hizo ma-award zikafanya watu waanze kuimbia award badala waimbe the word.
Mimi mkinichagua mtaona miujiza.
Anajifanya siku hizi.
Kibia mara moja.
Naogopa Mwenyezi Mungu na uji moto peke yake.
Hiyo si bangi.
This is NTV.
Hello, it's Africa. It's Thursday, the 23rd of April. Now, what are you up to today? Same as yesterday and the day before? At home? Keeping safe? Yes, I know your world has changed. So have we. Every weekday morning, at this time, we join you to try and keep you company as you adjust to your new normal. My name is Joseph Warungu. Good morning and welcome to your world. And remember that you can send your views, comments, questions, and your home videos to us. They're all welcome. You can reach us via phone, WhatsApp, Skype, or even hashtag New Normal. Now, Kampala city authorities have offered street children a safe place to stay during the nationwide lockdown over the COVID-19 pandemic. 180 of the most vulnerable people have been given a roof over their heads in a primary school close to Kampala downtown.
As a city administration, we have provided temporary shelter to 180 children who live and work on the street. What happened is that when the lockdown happened, we had children that live and work on the street, and when the directive to stay at home was made, they did not have a home to go to because their home is on the street. And then because they also live off the street, they did not have anything to eat.
The message that was out there that this disease, the pandemic, kills, yeah. And when they came here, they came for refuge, yeah. But to their surprise, they got a good team of social workers who are really helping them, like build other skills, life skills. Like even if those who choose not to go back home, at least they have a certain value that they have gotten from here.
Okay, and now to give you an update on how the situation looks like around East Africa and around the world, let's first of all have a look at the global figures. This is a situation, if I can get, yep, that's so much better. So far, 202,637 people, 718 have confirmed positive around the world. And the total number of people who've recovered is 717,790. And those who've died, 184,225. And moving across to closer home, in Kenya, this is our situation right here. Let me blow that up so we can all see that. Yep. 15,124 people have so far been tested. And out of this, 303 have so far confirmed positive. 14 people have died in Kenya, and we've got 83 people who have recovered. That's the situation in Kenya. Now, we were in Kampala a moment ago, so let's have a quick look at what the situation is around East Africa. In Tanzania, our southern neighbors, 254 cases confirmed positive. 10 people have so far died. We have 11 who have recovered. In Ethiopia, 114 cases positive. 3 people have so far died, and those recovered, 16. We also have in Somalia, 286 people. The figures there are climbing really fast. Confirmed positive. 8 people have died. We have 4 people so far who've recovered. South Sudan, not much testing has happened there. They've got 4 people confirmed positive. No one has so far been reported dead, and there have been no recoveries as at this moment. In Uganda, back to where we were in Kampala, 61 people have tested positive for COVID-19. No one has been reported dead, and 38 people have recovered. In Rwanda, the cases stand at 150 positive. No one has so far died, and the recoveries are at 84. In Burundi, where the testing is also still yet to catch up with the majority of the population, 11 tests confirmed positive. 1 person has been reported dead, and there have been 4 people who have recovered so far. That's the situation around East Africa and in Kenya. Now, we do not feel the joy of Ramadan, says a customer at a market selling traditional vines, lighteners in Egypt, as Egypt enforces a tight lockdown to try and curb the COVID-19 pandemic. From cancelled iftar feasts to suspended mosque prayers, Muslims across the Middle East are bracing for a bleak month of Ramadan fasting as the threat of coronavirus lingers. Health workers in Malawi, including doctors, have refused to go to work until the government provides them with personal protective equipment and better pay in the wake of the coronavirus pandemic. At Kamuzu Central Hospital in the capital, Lilongwe, many patients were forced to return home as there was nobody to attend to them. Madagascar President Andry Rajoelina officially launched a remedy based on local medicinal plants that he believes will prevent some patients from suffering from COVID-19. Now, the herbal tea has not been proven effective against COVID-19 by any published scientific studies or any authorities, but he still went ahead with it. Now, the government has moved to further secure the welfare of health workers in the country as they serve in the front line in the battle against the coronavirus disease. Any medics who get infected with COVID will be treated at a special treatment unit at the Kenyatta National Hospital and will also not pay a single penny. Seth Olale with more details on this.
The call to celebrate and safeguard the frontliners in the war on the coronavirus disease, who are medical personnel, continues to get positive response. The Ministry of Health, alongside the Rockefeller Foundation and AMREF, have launched a special designated isolation and treatment facility for healthcare workers.
Today, launching a special designated isolation and treatment facility for our healthcare workers. This facility will be able to offer both critical care, basic care services for our healthcare workers. All costs incurred during treatment shall be met by the government.
The wards are to be fully equipped with specialized beds and ventilators. Further, the Ministry of Health says it has obtained 4,759 personal protective equipment kits and over 237,000 assorted materials. This as the Ministry of Health confirmed that 2 doctors were infected with COVID-19.
One doctor is still under treatment, while the other one has recovered.
The doctor is among the 2 people who have been discharged, as the country recorded 11 new positive cases. As the infections increase, government is also cautioning residents from Nairobi's neighboring counties, namely Kiambu, Machakos, Kajiado and Murang'a, stating that the virus is increasingly spreading from the Nairobi hotspot to the grassroots.
Already, a number of your residents have contacted the virus, and we have isolated them for treatment.
The government believes the success in treating COVID-19 depends on the welfare of medics, and that is why it has treated 30,000 of health workers, targeting 100,000 more in the next 2 weeks. Seth Olale, NTV at the Kenyatta National Hospital, Nairobi County.
The rush to contain COVID in Kenya continues, with hospitals preparing for a potential spike in the number of infections. You've heard of the isolation centers, but what really goes on inside there? And when patients are admitted, what happens? Well, Leila Mohammed has more.
The special unit set apart within the Kenyatta National Hospital campus only hosts medical personnel and patients who are undergoing treatment for the coronavirus that has upended lives in most of the world. Movement in and out into the infectious disease unit is controlled to maintain the virus within these walls. Once inside, every precaution is taken to ensure that those coming in have a temperature reading of less than 37 degrees, and if the temperature is higher, one will be taken in for treatment. In between each step, medical staff and guests are expected to sanitize before dressing into the personal protective equipment that is needed before they can get into the wards. On this afternoon, we get our first glimpse of the fight against COVID-19 while walking these white halls, with a word with those isolated here clinging on to hope that the efforts of their caregivers will pay off. While some were up and about, beaming with hope for a better day soon, some who were not in the best of health were clinging to their lives in their hospital beds as healthcare workers dispensed medicine and monitored their progress. The government says they are getting the best care possible. Most of the world is using chloroquine and antibiotics to treat their patients and who have recovered. A universal cure and vaccine is still being sought, but at the moment, those who are battling the disease can only hope that they get better soon. The ministry says that it will increase the capacity of healthcare workers to battle the disease, even as some among them have fallen ill while in the line of duty.
The additional 1,000 workers that we will be hiring, those are going to be more specialized. We are obviously going to start off with a greater increase for the counties that are currently in dire need and move and increase as we go along should there be need. But for now, we feel that's a good number. We have already basically mapped them against the health facilities that we have already designated.
It is here that we caught a glimpse of the respirators aiding those with breathing difficulties. The corridors here might be cold and lonely for those undergoing care, but on the other side, those who are also being monitored after interacting with the ill are getting their lunchtime nourishment when our cameras visited the wards. Before leaving, the procedure to remove the PPEs follows strict measures just as before in order to keep the virus on the outfit and out of the public. Leila Mohammed, NTV.
Now, one of those guys there in those space suits is right here in the studio with me. He's my colleague from the print division of the Nation Media Group, Bernard Mwinzi, a managing editor here at Nation. Now, take me through that experience. First of all, was it your first time wearing that kind of suit?
Yes, it was my first time wearing the space suit, as you're referring to it. It's actually a hazmat suit, but other than the suit itself, there's also another myriad of protective gear. Talking about the goggles, gloves, hand gloves, boots, gum boots that are so white you feel like you're some sort of a special animal. But generally, yes, that was the first time I was wearing it. It was a bit of a terrifying experience, but also a bit of an enlightening one.
Okay. And now, obviously, you're today we're focusing on people who are on the front line, and journalists like yourself have been. What was the experience like in that isolation center?
When you walk through the doors, there's an area they call the clean area. When you're there, you feel like you're in just another normal hospital. There are people walking around. They are not in that protective gear, and you start feeling like, yeah, I think this is not as serious as I had imagined. But then you go there and you start wearing those suits. In fact, I remember asking them, are we going to space or something? The same words that you've used. And they told me, you have to. Otherwise, we will not let you through those doors. Then the doors opened, and there was this another world, basically. You feel like you've moved from your safe zone to another completely new world. It's very sanitized. There are gloves everywhere. Anything you touch, you must remove your glove. And then it must be guided. A doctor has to walk with you throughout.
So it was a supervised visit?
Yes, it is supervised. Yeah, because they said, actually even the medics themselves supervise each other. You don't go in there alone. And even when you're putting on the suit and removing it, it's under supervision. The medics supervise each other because they say, you know, you might make a mistake and that could immediately contaminate you.
Because the risks are quite high.
Quite high. Yeah. I mean, that's the reason they call it infectious disease unit. They've been, it's not just coronavirus that they've been working on. I mean, they told me the unit was, the infectious disease unit at KNH was first set up in 2014, 2015 to deal with the Ebola crisis. Luckily, Kenya has not gone through any Ebola epidemic. So even though there have been a lot of research, a lot of studies that have been conducted there, and even though they have hosted quite a number of patients, including cholera patients, this is the first time really that they are dealing with a disease that has global implications.
Now, you're a journalist. Why did you feel it necessary to get into this isolation center? I mean, don't you trust that people are ill and they're getting recovered?
Maybe I'm suicidal, and actually that's one of the things that people ask me, are you suicidal or anything? But then I sat and I wondered, how well do we tell this story? Because war correspondents, for instance, do not tell stories of war from their bedrooms or from offices. They go to the battle zones. We've been sending reporters to South Sudan and to Somalia. War correspondents in Europe cover the wars in Iraq, right? You know, you have boots on the ground. I think the same happens here. We cannot cover this war from the comforts of our offices or from the comforts of our homes. And that's when I decided, let's just go there and show the world what it really feels like to be inside a coronavirus ward. There is also this other, we have a lot of naysayers in this country. We have people who actually believe we do not have this virus here.
Indeed.
Yeah.
Indeed.
How do we tell them that story, and we show them the pictures and the videos? How do we take them to the world where we see people suffering? We found people who have been confined in a room for a month. A month. We found people who have been practically uprooted from their lives, from their families. Everything has changed around them. It's completely a new world for them. They cannot leave that place. Every time somebody walks into their room, he's wearing those spacesuits. They feel inanimate. They feel like they don't belong anymore.
Were they in different stages of recovery or isolation?
Yes. We found, I would say, different stages of recovery and isolation, and I would also say different stages of psychological warfare for them. There are those who are taking this coolly, they are fine with it, they feel like they will really, really beat it. Then there are the scared people, really, really scared. They think this is the beginning of the end for them. Doctors told me that some people actually have to be given sleeping pills. A lot of them have anxiety bouts. While they are not on any medication for coronavirus because there isn't any, they are put on several case management regimens depending on the conditions and the symptoms you present with.
Now, we're discussing about, doctors as well, nurses and other medical health workers who are on the front line. How did they feel? What mood were the medical personnel in? Is this just business as usual? Did they feel? What sense did you get from the doctors and other professionals that you interacted with?
It's a mixed sense, really. When you walk in, there is this relaxed atmosphere. It's not the helter-skelter you've been seeing in movies, people running around and all confused, sirens blaring, stretchers all over. No, it's a relaxed environment. So that's the one bit of it. But when you get in, they don't tell you, but you can sense it, that this is not normal. They themselves are a bit scared, even though they have been doing this. I remember talking to a nurse, and I asked her, so for how long have you been doing this? She said, I think that was, she had gone through about a year there at the IDU. And I asked her, what do you feel about this pandemic now that you are actually in the front lines of it? You're dealing with this. Every time you walk into a room, you are exposing yourself to possible contamination. And she said she's scared, but after some time she got used to it. When the first case was reported, Brenda and Brian, when the first cases were reported, they had been there just working with them, talking to them. Tests had not come to confirm that they were positive. And then she goes home. And in the evening, there is news that that man, the lady and the man, had been confirmed to be positive. And she said, I've been interacting with these people all this time. Now,
without any kind of...
Yes.
Yeah.
Now, no. Even for them, yes. Even for them, even before the confirmations, and because it's a highly contagious place. Every time you walk in, you have to have the protective gear. But even then, you're not sure. You're not sure. Even for us, even though we are wearing all those things, we are not really sure whether they are protective. And so for her, she said she was a bit scared.
Right.
Then she came to the office the next day, went, talked to doctors, and she said, they told her, yeah, this is fine, you're protected, you'll be fine.
Now, having visited the isolation center, interacted with the doctors and the patients, how does that influence the story that you tell, or the story that we tell as a nation?
I think it opens your world to so many other possibilities. All of a sudden, the story has a face. We've only been talking about the voices and the numbers. But now...
all we had was Mutahi Kagwe's
all we have was Dr. Corona himself telling us, the figures every day, the number of infections and all that. But we hadn't really gotten into these wards and talked to the people who are going through this pandemic, who are actually experiencing the pains, the physical pains of not just confinement, but also the pain of stigma, of isolation, of being in a place where you feel like the world is crumbling all over you. So we managed to put a face to the victims of coronavirus. In the office now, We are aware, quite aware, of not just the numbers that are being bandied around, but also what those numbers mean. People have been talking about flattening the curve. People have been talking about vaccine and other things that sound ambiguous to the people in those centers. For them, it's just life by the minute. It's not about whether the government is doing anything. Yes. For them, it's whether we are going to recover, whether you're going to walk out of this ward safe. And I think that will, for the foreseeable future, inform the kind of coverage decisions that we make.
Okay.
Yeah.
I'll come back to you for more on that. But we are joined on Skype now by Dr. Lois Achieng, who is leading the COVID response team in Kenya, based at Mbagathi, Kenyatta National Hospital. Good morning, Dr. Achieng. Welcome to Your World.
Good morning. How are you?
Very well. I can't hear you in the studio quite clearly, but if you can... Yes, that's...
Can you hear me okay? Can you hear me now?
So give me a sense of what your day-to-day involves.
I hope you can hear me well now.
Yes, Dr.
So,
Dr. Ching, if you can hear me, give me a sense of what your day-to-day involves.
So one, I head the infectious disease unit at KNH. I work with a team of doctors and nurses. Most of my days would be one around making sure the units run well, a lot of consultations from the doctors and from the nurses. Sometimes I have to see patients as well. We're also doing a lot of work with the Ministry of Health around sort of figuring out what's the best way to move forward. And, you know, a lot of consultations from around the country, really, from colleagues and from other sectors as well.
Now, I'm in the studio with my colleague Bernard Mwinzi, who was fortunate enough to be part of the Nation Media Group team that went to the isolation center. How well, Dr. Chen, do you feel that as media in Kenya, we're telling the COVID-19 story?
I think the media has done a commendable job. You're telling a lot of the stories. I'm not sure what more can be done so that people take it seriously, because from what we see again in the media is that for some reason many people think it's not real or it's not serious. So maybe a lot more education from the media, you know, to tell people that yes, this is real. People get sick. Many people may have mild disease, but some get very sick and some even die. That some of the directives given by the government are not just punishment, but it's really meant to protect us. And that when I protect myself, I protect my family and I protect my neighbor. So telling the story in such a way that people begin to take personal responsibility for their own health, but also realize that we have responsibility to our loved ones and our neighbors. If we can get to that point, then it will be so important. I think as you visit the hospitals, you realize that, you know, doctors, nurses, other healthcare workers put in a lot of work. As one of the nurses told you, yes, sometimes it's scary. Sometimes when you have to wear all this, you think about yourself and you think whether you'll be safe or not. And sometimes very disheartening when you see Kenyans, you know, going into parties at night when you ask them to stop public gatherings. So finding an angle where people can actually understand that this is serious, that there are healthcare workers who are putting their lives in the line for the sake of Kenyans, so that they begin to take responsibility, would be really, really important. But I think so far the media has done a commendable job.
And maybe, Dr. Ching, to help drive that message home, can you give us a sense of what really happens to the human body once you contract this virus, and if you become seriously ill? What actually goes on in a human body?
So one is to understand that there's a spectrum of disease, right? So some people may get mild disease and, you know, they may not have symptoms. Some may have milder symptoms like a sore throat or a cough, but some have what we call a severe pneumonia, which means the lungs are totally messed up, so to speak. And, you know, someone is unable to breathe or get enough oxygen into the body, which means at that more severe spectrum of disease, we need to add you oxygen. If you're unable to still, get enough oxygen into your body with that, then we may need to put a tube down your throat and connect you to a machine that actually drives that oxygen into your lungs. At that point, other organs may also begin to fail. So as we've seen from many other countries and even from our own more or less little experience with people who get severely ill, is that by the time someone actually requires to get onto this machine, what you've had as ventilator all along, is that most people don't do very well on that. So the main thing is to make sure we get people early, treat them early, make sure we prevent any complications as fast as possible so that we don't get very many people getting severely ill. The other thing to note is that there's certain risk factors for severe illness. So those who are older, those who may have certain other diseases. So it's really important that people who have these risk factors stay home to reduce the risk of getting infection.
Dr. Ching, thank you. Stay on the line for a moment as I cross over to Dr. Bernard Langat, who is a program director at AMREF, responsible for or supporting some of the other non-communicable diseases, as well as TB, malaria, and HIV. Dr. Langat, good morning. Welcome to Your World.
Well, good morning.
Now, I know you focus a lot on community, and where we're at with COVID-19, we've moved into the phase of community infections. Can you give us a sense of what does that actually mean, and what are the implications?
Well, thank you very much. Maybe just to start, in terms of, we now seeing that the level of awareness and knowledge with the communities is quite high. And I think the unfortunate thing is that really converting that knowledge to action is a bit wanting, because at the moment hand washing it has taken off, although hand washing people don't use soap. The use of face mask is still low. In one of the survey that was done recently is around 40%. So really for community engagement, the main focus is to give the right messages to the communities and trigger them to take action. And the action means really adopting the preventive measures. And these measures include staying at home, social distancing, hand washing, use of sanitizers. And when there are symptoms, then report to the authorities. And that is work that takes a lot of effort. Sometimes it's not easy in informal settlement, for example, to talk about social distancing when you already know it's a congregate settings. There are quite a huge population in a small area. Access to basic water and sanitation is a bit of a challenge. But we have managed to mobilize enough civil society organization, and there's a lot of movement and action in that direction, and we see it's a slow adoption, but at least there is positive movement.
Dr. Langat, we have the experience of having dealt with other health crises like HIV, AIDS, and TB. Maybe taking TB, for example, are there lessons that we've learned from TB that can be applied to the fight against COVID-19?
Yes, I think there are many lessons we can take from tuberculosis. One is, of course, tuberculosis is a respiratory condition, is infectious. And really, so the idea of identifying the cases early and isolating and putting them on treatment. And when you get a case, we actually do what we call contact tracing. So you have to look for immediate contacts that are likely to have been exposed, and then of course, investigate and where of course you get the cases, then you start them again on treatment. So I think really tuberculosis brings a lot of experience in contact tracing, is the use of laboratory to make a diagnosis, and even involvement of communities in terms of contact tracing, and even where people fail to take medication, they also do default tracing. Thank you.
Thank you. Dr. Ching, if I may come back to you again, what are you preparing for? I know that the mass testing is yet to really take effect, and so there is a possibility that these numbers could rise. What does that mean for our health systems, even for you and your team?
So at this point, I guess the numbers that we have are such that you're able to admit everybody who is sick. As time goes on and we get more the hospitals may not be able to admit everyone who tests positive for COVID. So it means that such a time we'll need to find places where, people can be isolated. And the whole point of isolation is so that you protect, especially your household, so family members and your immediate neighbors. As we've seen in other countries, that number could go even higher, which means we may get to a point where people need to take care of themselves at home if they're not too sick. And the hospitals are only left for those who are very sick, who require no active management in hospital. So at such a time, again, I guess the responsibility to the individual will be even higher, because we'll know that, yes, I have infection, and yes, it depends on me to protect other people. So even as we begin to think about such a time, the whole issue of how we take care of each other becomes extremely important. Right now we are managing, but if, the projections and the lessons we're seeing from other countries are going to, be seen here, then we really have to plan about a time when people take responsibility for caring for themselves at home. We hope we don't get there, and that's the reason why hospitals are admitting everyone who tests positive, because if you isolate people, then you reduce the chance of everybody getting infected. We know that eventually many people will get infected, but if you slow the rate, then it means health facilities are not overwhelmed and fewer people die as a result of that.
Okay, and although COVID-19 is new to us, in a sense, you and your team and our health facilities were preparing for other bigger emergencies as well, like Ebola. Are there things that we have learned from that to help us cope with the current situation?
So over the last few years, I guess, for example, when the unit I work in opened, it was a time when we were preparing for Ebola. That's when there was the West African outbreak. So we did have people come in who were suspected to have Ebola. And I think from having to manage those situations, the healthcare team has become a little more prepared, has become a little more calm. So some of the fear around how to protect ourselves has sort of gone down. Over the last few years, we've managed a lot of patients with cholera, for example, and patients coming in with infections caused by very resistant bacteria, for example. So in learning to take care of these patients, the issues of, developing a strong team, developing good team communication, learning to communicate with patients where there's what you think of as a scary situation has, we've gone through that over and over again. So the teams are a little more prepared. But having said that, it's not a very large team that has had to do that. So there are many parts of the country where people are having to deal with this for the first time. And it's expected that, healthcare workers will be a little scared. Everyone will be wondering how to manage. And that's why our common rallying call is to ensure that there's enough protective equipment for healthcare workers, so that even as they step in, there's an added layer of confidence, so to speak. And, the fear is taken out of this equation so that healthcare workers give their very best.
Okay, and finally, just before you go, a lot of Kenyans, we feel that our lives are in your hands. What is the mood amongst your team? They're in this. We don't know when it's going to end. What's the spirit in your team and other health workers that you interact with?
So one, I guess we all hope it doesn't go on too long, because other than the anxiety, especially for those who don't work within the infectious disease unit, there's a bit of anxiety because you never know who the next person coming is going to be. So you don't know whether the next person may have COVID, not have COVID. So there's always that heightened state of alertness. And, that heightened state of alertness can only be maintained for so long because fatigue begins to creep in. So at this point, I think a lot of healthcare workers are aware. They are fairly anxious. They want to give it their best shot, yet protect themselves and protect their families. But we really hope this doesn't go on for too long, because it's uncomfortable to be in this, in this gear that you saw in the facilities for a long time. It gets tiring, and that when people are tired, they're more likely to make mistakes and expose themselves. So I think even as we give it our best shot now, we are all praying that this doesn't go on for too long. And as we pray that this doesn't go on for too long, we know that the only way we'll break this chain is if Kenyans work together. So our appeal really is to Kenyans to, listen to listen to what the government is saying, follow the instructions that have been given. The restrictions are hard on everybody, but if we all follow them, then we'll be here for a shorter time than if we all continue to act as normal.
Okay, a quick comment from you, Dr. Langat. How are you preparing as well as AMREF?
Come again?
How are you, as AMREF, how are you preparing for the weeks ahead in this crisis? Can you hear me, Dr. As we try to...
Yeah, I think there was a slight connection problem. So just come back again.
Okay. I was just wondering, we've heard about the situation at, with Kenyatta Hospital and other health workers. But as AMREF, what are you preparing for in the coming weeks?
I think at the moment, really, if you look at the cases that are coming, we are already seeing community transmission. These are local cases. And that means there's active transmission in the community. So basically for us really is we keep on engaging with the communities to tell them that COVID is for real. I think there's this, if you look at one of the surveys, there's feeling that when we actually in a sample, most of them have not met a case of COVID. They have not even, very few have interacted even with a relative that has COVID. So for them, it's quite distant, and they imagine that is not going to get them. Africans are safe. So really, we keep on trying to engage the communities and telling them this is for real. Yes, you may not be aware that there are cases because testing has not expanded. Maybe with this mass testing, people will be able to see the reality that there are potential cases in the communities that might not have been identified. And therefore, the main thing to do is precaution. Let's follow what the government says. When we talk about staying at home, it's really staying at home and observing social distancing. It is restricting incomes, is restricting movements and socializing, but it is for the best. So for community engagement, we have decided to really spread out to the whole of Kenya. We are looking at we have seen cases in Mandera, and we felt that even in our engagement, they were a bit not well engaged. The ALSAL, the arid and semi-arid lands. So we have actually tried to focus on key populations, people living in refugee camps and immigrants. Because this is also a group of people that may not necessarily already contain, and they may not get the best of support from the surrounding communities. So for communities, we have decided that we isolate different social groupings and focus on them and use the right channels that is able to penetrate. If you are dealing with the youth, which the majority don't feel like they are, for them the risk is low, and so they should not worry. But ideally, we are engaging them and telling them it is for them to protect their families. Even though the fatalities is very low, families, they can be the source of the infection in the family. So we are really looking at, the estimate initially was around 1,000 in mid of April. So we still follow those estimates to say that there's potential going to be a huge number of cases that we have to respond to it.
Okay. Thank you so much, Dr. Langat and Dr. Loisa Chingombacho. Before I release you, we want to thank you and to celebrate you. This week, we've been showing our appreciation to frontline workers, including medical personnel. Well, thank you so much to our two guest doctors there, Langat and Dr. Lois Achieng Ombacho, and everyone who's at the front line of this COVID-19 pandemic crisis. We want to thank you so much as Nation Media Group and wish you all the best. We're in this together. Madaktari, asanteni sana. Now, Mwinzi, back to you. We're talking about thanking these doctors. As a group, we've done that. It's not enough. There are countries who are doing a bit more for their health workers, their frontline workers.
Yeah, it's true. It's not enough just clapping for them. I saw a comment yesterday. Some people were saying instead of just clapping for these guys, let's also shake up their bank accounts,
right,
to make it up and down. But I think even though we had the advantage of time, because we had seen what was happening in the other countries, and you had expected that I will have prepared for it. Our doctors are also learning on the job, just as we are. There are so many things that are happening within the healthcare system right now, which is so stressed by this virus, that it's not easy for doctors and even the government to really say that they have everything in order. And so you've heard Dr. Ombajo there saying that it's not just telling people to take care of themselves. It's also taking care of the doctors. They need to have enough protective gear. In some countries, in some counties in this country, you see doctors working, being asked to go to the front line without protective gear. Now, when you're dealing with such an infectious disease, clapping is not enough. Really, it isn't. We need to protect the people on the ground, the people who are really, really fighting for us and who are doing everything to ensure that we put this thing under control.
Now, I'm talking about protective gear. As much as an individual, you may protect yourself, you may keep your hands sanitized, you may wear a mask. There are those in the population who will not follow that. And I know it's been a subject of concern to the media, wondering how hard they should go in calling out such people.
Yes. There are a lot of naysayers in this country, a lot of naysayers who believe this is some lie that we've manufactured or has been manufactured by the government, and the media has been bought to propagate that lie. But that's not true. We've seen even in communities where, even though we are talking about social distancing, washing your hands regularly, sanitizing whenever you can, wearing a mask, people are saying, I'm really not interested in that. I'm an African. Mimi ni chuma ngumu. I can survive this thing. But when the reality hits home, and we've been looking at where we are in terms of numbers and comparing with other countries, you can see the trajectory is almost the same. That the numbers are rising. When we were at 10, 20, people were saying, this is not going to really affect us as much as the other countries. But we are seeing possibilities of this thing really, really hijacking our healthcare system and running away with it. So what we are doing here at the Nation is shaming those who do not believe that this thing is here and who are not taking care of themselves or protecting those around them. We are taking photos of them. We are taking videos of them. We've asked our bureaus to be on the lookout for these people who are either disobeying government orders or who are not following the containment orders that have been ordered. And that is really, really essential, because while the doctors are fighting this from the hospital wards, we as journalists are fighting this from the newsrooms. We are using our cameras, we are using our pens to tell this story and to show people what is happening and what they need to do.
And in just one question again, back to when you were at that isolation center, either going in or coming out, did you have to do a test yourself?
No, we did it, but before walking in, you write your name, where you're coming from, your ID number, your mobile number, just in case. And then they check your temperature. They record it, that this man got in here at this time, he lives here, his name is this, and this was the temperature at the time of him getting in. Then, of course, they write your name on the hazmat suit that you're wearing. And I remember asking, why do you need to write my name? Indicating who you are, and again, on the suit at what time you got in. Then as you're getting out, again, the same ritual is repeated. And for them, it's not just about records. It's ensuring that anything, in case anything happens and you're contaminated, they can know at what time you're contaminated, who you are, and what you're doing there. Why you authorized to be there in the first place. And then what are the other things that they need to do? Maybe one of you is contaminated while there and you ride the same car back to the office or back to wherever you're going. So they also need to trace everyone who was there. So that ideal is what everybody is aspiring to, that ensuring people are safe, even when they are on the front lines, that their vitals are taken and their contacts are taken, and they will be traced in case anything happens.
I don't know how you arrived at who should go to that isolation center, yourself and colleagues, because there are people who, even though they're journalists, they would not want to volunteer to be on the front line, as it were.
Yeah. I remember when I first started asking the ministry to let us in, there are some people asking, why do you want to go in there? We had developed protocols here on coverage. We have guidelines. How far can you go to tell this story? Remember that mantra that no story is worth dying for?
Yes.
So there are some people who said, I don't think this is a story worth dying for. But then there are others who are courageous and they said, yeah, we need to go there. So when eventually the ministry allowed us to go in, we just spoke among ourselves, and there are those who said, yeah, I want to go. And I carried along a reporter and a photographer. And then when we got there, no, actually even before we got there, I remember we were discussing again, and one of them asked, is this really worth it? There are guys who actually think we are being suicidal with this. But then I thought about the guys who are already there. You know, there are doctors who wake up every morning, nurses who wake up every morning, and they go there. So that's their office. So they go there every day. Why can't we go there and see what they do? We keep inviting them to our newsrooms for them to see how we conduct news, isn't it? So we said, let's go and tell this story right from this from the front line instead of reporting it from our comfort zones.
Okay, Muzi, stay with us and talking about people on the front line. Now, essential service providers were caught up in confrontations in different places. I hope I can be able to find my script here. Yeah, police had to intervene to disperse and arrest some people who are, trying to actually cross, a roadblock in Thika. And this is what we reported on the incident.
In what was seen as intensified measures to block movement of people out of the mapped region, officers manning roadblocks were taking no chances in stopping and repulsing vehicles. Among those who were caught up in the confusion that occasioned a crazy snarl-up are medical professionals and health workers, food dealers, distributors, wholesalers and transporters of farm produce. Not even patients being ferried for further assessment to hospitals were allowed to go beyond the roadblock as police went further to check vehicle stickers, identification documents, and documents provided by relevant agencies to permit movements. Rose Mundia, a senior nursing officer at Thika Level 5 Hospital, was among healthcare workers who were barred from entering Kiambu County from Murang'a by the GSU officers. Despite being in possession of and producing a letter from her employer, she was forced to return to Murang'a County, where she resides, as the officers denied her passage.
Tumeambiwa until all of us were cleared, na niko na sticker hospitali. Sasa tunangojea kuwa cleared tu. The process is taking too long.
Sasa watu wa kufraud, hii ndio kazi yao. Day in day out. Sasa tumepitia gate, polisi hawakutuzuia. Wamewaona.
Samuel Maina, construction material transporter who was ferrying sand at Githingiri Estate, was among 4 persons that detectives arrested and are expected to be taken to a 14-day forced quarantine. Haile Magongo, NTV.
Okay, and now we look at some of the other frontline people who are working on the front lines in different capacities. Sylvia Kuria is an organic farmer. She joins us now, I believe. Good morning, Sylvia. Can you hear us? Good morning, Sylvia. Okay. We also have Shadrach Asiati, who is a security guard. Shadrach, good morning. Can you hear me?
Yeah, good morning to you. I'm getting you loud.
You can hear me, but I can't hear you. Try again. Yes, speak again. Shadrach.
Yes, good morning.
Good morning. Let me start with you. I can hear you. Just
Yes.
tell us, what do you do on a day-to-day basis?
I think you in security industry basically is a service industry.
Yes, keep going.
So service industry, we basically serve and protect. We protect life, we protect property, and service entails customer care service. So we interact with, we do that direct contact interaction with strangers on a day-to-day basis. So I can say we are very much exposed. We get into contact with mostly, I can say, strangers. You can, with this pandemic, our work, we are so much exposed, so we have to treat everyone as if, like our CS says, that treat everyone as if he or she is infected. So we do our best, and we always work to ensure that we protect ourselves first, and we want to...
Shadrach,
yes?
Ebu niambie, amongst the security guards, mood ikoje? Mnaongea mambo gani? Watu ni kitu gani ambacho kinawaletea wasiwasi? Kwa sababu kila nikitoka hapa jioni, nikienda nyumbani, ambapo baada ya masaa ya curfew, watu ambao kabisa hawapo, kila mtu amekwenda nyumbani, watu ambao nakutana nao ni askari na walinzi kama nyinyi. Mnapoongea, ni matatizo gani ambayo mnakuwa nayo, wasiwasi gani ambao mnakuwa nao?
Wakati tunafanya kazi, kama sisi unaelewa, tuna work on shifts because security has to be there 24 hours a day. So we work in 12-hour shifts. So 12-hour shift inaanza saa 12 asubuhi, saa 12 jioni, and then 6 p.m. to 6 a.m. So because of the curfew, wenzetu lazima tukuje tuwatoe mapema, na you understand hii mambo ya curfew. So by 5 inafaa uko umefika kazi, so ufike kazi watoe mapema, so that sometimes some of our colleagues get harassed ile because they fail to beat that time ya curfew. So
kwa hivyo bado mnakuwa na shida na polisi njiani mnapokuwa mkienda nyumbani?
Naweza sema ikianza tulikuwa na hiyo shida, lakini at least nowadays they are more understanding. Cases zile reduce kabisa, and we thank them for that. I think wanaelewa, you know, sometimes walikuwa na ile, najua ile watchman mentality, unaelewa. So you can, umefika mtaa, unaambia maybe you are out of that, saa moja imekupata, unaonyesha hivyo, wanakuambia ile tu, naweza sema harassment, but nowadays we can say si vile.
Asante. Sylvia, I don't know whether you can hear me. Good morning. You can hear me? I can't hear you. Just speak up again, please.
Yes, I can hear you.
Oh, fantastic. Tell me about what you do. Give us a bit more details of what you do.
Okay, so anyway, so I'm basically a farm. So we actually we have produce on the, and we also get produce from other suppliers, a shop. So we basically grow up.
So sorry, Sylvia. Let me. Sorry, the audio on your side is not too great. We'll just give us a few minutes as we try to establish a better connection. We've got someone else joining us as well. Good morning, Daisy. Can you hear me?
Good morning.
Yeah. What do you do?
Yes. I work at the front office department at Melchizedek Hospital.
How has COVID-19 impacted your own life and in the work that you do?
It has made me extra cautious for the sake of the people around me, and it has made me become aware of the fact that it's important to protect myself and to also protect the people around me.
Can you give us a sense of the kind of interactions you have at the hospital? A lot of people coming into the hospital will pass by you. What have the interactions been? What are the issues? What are the concerns?
One of the major areas that we actually work on is ensuring that every patient or anyone who comes to the facility comes in with a mask. We also have a screening area to ensure that patients who have severe symptoms are isolated in such a situation. Also, we have to ensure the social distancing at work, and we also encourage cashless payment, and we also encourage frequent sanitation and also disinfecting of surfaces.
And has your own life changed? Have you had to make any adjustments because of this pandemic that we're experiencing?
Sorry?
Have you had to make any adjustments or changes to your own life or lifestyle because of the pandemic?
Yes, definitely. I'm extra cautious in everything I do. Proper disinfecting of surfaces, ensuring that I'm using sanitizers throughout, washing my hands. Also, ensuring when I get home, I wash my hands before I enter the house, and also disinfect my shoes, my clothes, everything around me. Yes.
Now, we were discussing a little earlier about people who don't follow instructions, for example, to wear masks and stay safe. Have you encountered any incidents of people who are a little bit difficult to deal with in your work?
Not so many people. Those ones who actually are quite difficult, we handle them from the security. From the moment that anyone enters the hospital, we have to ensure that they have masks. So we tackle that quite early.
Okay, thank you. Stay with us. We'll be back with more. But first, we have been receiving your comments and videos and questions via #NewNormal, as well as WhatsApp line and our telephone Skype. Let's see what you've been saying. This one is from Wawero. You've given us a list. Salary delays, hiked fares, lack of basic PPEs like masks, lack of transport means being recognized by clubs rather than an allowance, delays in some roadblocks. Okay, thank you for that list regarding our frontline workers and the challenges that they experience. Jerry Mukiri, you say that every morning having to go through a roadblock with a lot of uncertainty. The police officer sometimes not willing to listen, despite having the necessary documents, getting to work late due to the delays at the roadblock. Thank you so much for that. Isaac Juma, as an essential worker, I have had a lot of harassment from police for roadblock. High amount of bus fare from 300 shillings to 800 shillings to and fro so as to perform my duties. Sometimes I'm forced to walk a long way by foot. Thank you, Juma, for sharing your experiences. Joy Melino, I'm an essential worker here in England. God bless all the essential workers there in Kenya and everyone else too. Stay safe. Thank you for reaching out to us all the way. Judith Talam, hiked fares. This is your biggest challenge, indeed, amid the pandemic. Dennis Odhiambo, your prayers and support in any way is still and will still be appreciated during this time. Thank you, Dennis. We also have a comment here from Joy Obilo. Lack of the protective equipment at work. That's your biggest challenge. That's a comment that's coming up quite a lot. Ramadan Kosgei, everything is not moving. Wow, okay. And we've got, this is Michael Kabiru who's saying, being asked to buy kahawa in every roadblock I pass. Dorman's Coffee, kindly donate thermos and coffee to these guys in blue. What the cops want to do, they want real coffee. But I hear you, I see your comment there. James Mburu, delay in the payment of salary. Yep, we feel you on that. And another comment here from, this one is from Rudhugwa Eric Mureithi, reduced cash flows. A lot of people experienced that. And we'll be hearing more. Keep them coming in via our #NewNormal. You can also call us up. You can send a message on WhatsApp. But now, we'll take a short break.
My name is Colin Zinjera, and I'd like to take this opportunity to wish my fellow Kenyans peace and safety during this difficult time as we fight the coronavirus pandemic. Please do follow the instructions given by our President, His Excellency Uhuru Muigai Kenyatta, and the Ministry of Health as we combat the pandemic. Wash your hands thoroughly with soap and clean running water, or use sanitizers where necessary. Keep your environment clean. Stay at home and avoid unnecessary movement. Take the necessary precautions to keep yourself and your family safe. And to my fellow athletes, if necessary, do train in isolation and keep safe. We shall overcome this pandemic. God bless you and God bless Kenya.
It has been described as a silent killer. What exactly is pulmonary embolism?
This is a situation when a blood clot jumps into the lungs.
I had 2 clots and a pulmonary embolism that was suspected but could not be confirmed.
Pain in the calf, swelling of one leg, pain when breathing in. If you have that, go to the hospital.
We're talking about pulmonary embolism, and you can abbreviate it to PE.
Ensure you go to the hospital. Don't assume anything.
Carry on hand sanitizers and face masks. Protect yourself against COVID-19. We have a series of products to keep you safe during this COVID-19 pandemic. Contact us on 0703 222 000.
We're getting impatient here.
Fabian, we still couldn't find the money.
Why let this market vendor join us? Why don't you start asking yourself if you're playing the lead here or just another extra who can be tossed aside?
Isn't he your accomplice?
Who, Rocco? If you think you're the princess here, I've got news for you. I've risen the ranks. That's right. I am the queen.
Okay, let's now link up with another of our frontline people. Sylvia, good morning. Can you hear me?
Yes, I can hear you very well. Good morning.
Morning. Now, tell me, what do you do?
So I'm basically an organic farmer. So we actually grow lots of vegetables and fruits. And then we also buy produce from other farmers from all over the country. And then we just take our produce to the shop. And then we sell from the shop in Nairobi, and we also do home deliveries.
Okay. Tell me, why are you a frontline person?
Because we are actually, providing an essential service and product, of course, which is food, because we all need food to survive. And so, like without farmers, really, we cannot survive. We all need to eat every single day.
What have been the challenges and even opportunities around this time? Because now you are delivering differently, people are ordering differently, and so on.
Yeah. So let me just say, like, the major challenge has been just to be able to actually access, the food and the products. It's been quite difficult because what we find is that, like most of the food that is grown is actually out of Nairobi County. So which means that we have to get through the different roadblocks. And what has happened is there has been no clear protocol on what paperwork farmers actually need to get across to get their produce and bring it back to the city. Let me give an example for myself. Like when the when the restrictions, were put in place of travel between the counties, like I was not sure what to do. And, I called my chief back in the village, where we have the farm, to ask, do I need any paperwork? She wasn't very sure about it. I went to the police stations. And what happens is when you get to the roadblocks and then now you have to, try and, beg, the police and tell them I'm a farmer. Then you have to come back with your produce and, you hope that they're going to let you through. So it's a bit of a hit and miss. And when I think about the other farmers who also bring us produce from outside the county, like from Machakos, they don't have transport to get across, the borders, So what happens is they have to hire vehicles, and it's very expensive for them to hire vehicles. And when they do so, they get to the roadblocks and they find they don't even have the proper documentation because no one really knows what you need to get across. And the opportunities have also been there.
Just on that for a moment, if I may linger on the roadblock issue, we've had instances and reports of police sometimes being quite difficult, even on people who are legitimate frontline workers, including medical staff who've been harassed. So when you actually get to the roadblock, do you have to open up your truck for them to see, yes, I've got cabbages and tomatoes? What are they looking for to let you through?
Okay, so basically, it's a bit tricky. When you're getting to the farm, you have an empty vehicle. So convincing them that you're actually going to get produce is a difficult part. And they're basically just wanting to see maybe if you have some sort of authorization from your leaders. And what happened was, in my case, let me just give my example. I didn't have any papers from my chief. So they let me go because maybe you just have to be a bit convincing, but that's not for everybody. But when you come back, you actually have to prove that you actually, because you have to pass by the same roadblock on your way out. So you basically just have to show that you have the vegetables in. But what happens is, it's been changing, the goalposts have been shifting. Last week they were okay with me showing them vegetables. But this week what happened, at some of the roadblocks, they were asking me to produce a food hygiene and license. Food hygiene license and a food handler's license, which nobody had told me about. So what happens is there's no protocol. Nobody knows what you need. You don't know if you need a letter from the police station. You don't know if you need a letter from the chief. So what happens is, you just, hope that when you get there, you'll be let through. And I know some farmers have actually been sent away with their goods because, they just don't know what to do.
Okay, Sylvia,
so that has been the problem.
There's a bit of help here from the Rift Valley Regional Commissioner, George Natembea, who has issued an order that stating that all vehicles transporting food items to Nairobi should not be blocked.
Tumeweka askari na multi-agency team, askari wote wa vitengo vyote, askari wa Kenya Police, wa APS, wa CID, na pia kuna roadblocks ambao kutakuwa na National Government Administrative Officers, ile ngazi ya ma-ACCs, ambao watakuwa napeana report every morning kwa command centers ni nini kimefanyika usiku. Tungependa pia kusisitiza jambo moja kwamba pia maofisa wetu wako under very firm instruction kuhakikisha kwamba yale magari ambayo yamebeba vyakula, ikuwe ni mahindi, ikuwe ni unga, ikuwe ni mchele, ikuwe ni maziwa, hiyo magari inapewa facilitation kupita. Na maana watu lazima wanahitaji chakula kuingia Nairobi, kutoka Nairobi, lazima hiyo chakula ikuwe facilitated, watu wapate chakula.
Sylvia, I'd like you to react to that comment. Obviously, that's only just one region, but he's been very clear that these vehicles should be let through. But he doesn't specify what kind of documentation, apart from the produce that you carry, you actually need. But do you think that is helpful, that kind of an order?
Yes, it's very helpful. The thing I just wonder is that, is it possible that they can be able to,
Oh, we seem to have lost Sylvia there for a moment. Let me now move over to Mr. Kenodia, Stephen Kenodia, who's joining us. Good morning, if you can hear us. Oh, okay. So, Sylvia, let me try you once more time. Can you hear me? Okay, I can't hear you in the studio, but you can hear me. I'll come back to you in a moment. Yes, I can hear you now.
Yes, I can hear you very well.
If you're able to follow that that order that was issued by the Rift Valley Regional Commissioner, is that kind of thing helpful for people like yourselves who have to cross these county boundaries?
Yes, it's very helpful. It's very helpful for us. But I just wish that if it was possible that, that information could be passed on countrywide to all the major roadblocks, then that would be helpful for farmers, because some of us are lucky because we are able to, access this information. But just try think with me, the many small-scale farmers who are working with us down in the village who don't have access to a smartphone, who don't have access to all of this, maybe they didn't listen to the radio when this was being announced and they are still being harassed at the roadblocks. So I just wish that the information can be put out there, can be put in circulars, the same way we are getting messages on our phones about COVID-19 from the Ministry of Health. Is it possible that even such messages can actually go out, to all the citizenship so that we can be able to be aware? Because I find many people are struggling because they are just not aware and they don't have access to information.
Okay, now what's happening to the price of food while we are at it? Is it going up? Any changes?
It's slightly going up, but it hasn't really gone up considerably. Like for us, we are still able to get a bit of our produce. But, it's starting to go up slowly by slowly. It hasn't really gone up too much. I think it's still affordable. But the unfortunate thing that is happening is that because of the restrictions that have been happening, what's happening also that we have quite a number of farmers who actually have their produce, which is rotting and getting spoiled on the farm just because they can't be able to access it to, the majority of persons in Nairobi.
Okay, thank you so much, Sylvia. Let me now cross over to another contributor, Mr. Stephen Kinodia. Good morning. Can you hear me?
Yes, I can hear.
Yes, first of all, congratulations for overcoming COVID-19.
Thank you. Thank you.
Can you share a bit of your experience in France, how you fell ill and how long you are in hospital?
Thank you for inviting me this morning. NTV TV. I'm Stephen Kenodia. I'm a Kenyan from that part of Githongori, Kiambu County, but I'm in France. I was sick in France, in Paris. I felt sick on the. I'm a director at TFC Tourism Finance Corporation, but I'm also a diaspora leader. I felt sick on the 23rd. I went to do some gym, and when I came home, I started feeling some nausea. Before taking, some this traditional concoction of lemons and all the concoction, the African way, for 2 days, because I thought it was just some nausea. On 27th, I've become more serious, and I called my doctor. So he told me to go to his office. And he gave me some medications, which are some antibiotics called azithromycin, which is being given to people who have COVID. He confirmed that I had COVID-19, and he gave me those antibiotics with some painkillers because my body was very bad. Because people who doesn't know the symptoms of this disease, you start vomiting. You start feeling that you want to vomit, but you don't vomit. But then you have a severe diarrhea. You have some headaches, some pain, body pain, like you have malaria for those who have got malaria, and then you start a dry cough, some running noses from time to time. Your eyes are crying from time to time, and then your body temperature goes between 39 and 40. So going back to my story. I went to the doctor. He gave me azithromycin antibiotic for 3 days, and I came back home. For those 3 days, my situation was not getting any better. So on first, since it was a Fool's Day, I could not call him, so I decided to call him on second. On second,
how did you?
Him, he told me I was very bad because I could not even breathe. My lungs were blocked. I called him and he told me there's no need of coming to my office. Just go direct to do the chest scanner. I went to do the chest scanner. I told my wife, okay, I cannot walk. I could not walk for three steps because my lungs were so bad. So my wife had to take me to the scanner.
So you are, Mr. Kenodia, you are quite weak at this stage. How did you get to be admitted?
That's where I want to come. I went to do the scanner, but when I got, they put me in that machine, of the scanner machine. They told me you are in a very serious position, and then they started putting all the mask. I was so scared because they knew that I had that virus, and my lungs were completely blocked. So they called the ambulance, and I was taken to St. Louis Hospital in Paris in the 10th district, where I was admitted immediately. First, I went to the emergency unit, and then admitted to ICU. From 2nd to 12th, I was in the ICU for treatment.
Mr. Kennedy, because I just want to cover enough ground, so sorry to hurry you up along with your story. How long were you in hospital in total?
In total, I stayed for 14 days. I spent 14 days, 12 days in ICU, and 2 days for recuperation ward at infectiology and pulmonology unit. At St. Louis Hospital in Paris.
And during
I was released on the 14th, but right now I'm confined at home for another 10 to 15 days for medical follow-up and observation, and also for them to see that to see whether I'm getting better, because the antibiotics which I got, France has 3 antibiotics. They are not using chloroquine. They have their own antibiotics, which I signed one of the protocols. I'm one of the testimonies that
Mr. Kennedy,
they have a study of 23,000 people.
Mr. Kennedy, just before you go into your testimony, let me take you back a little bit to the hospital. When you were in critical situation at the hospital, what was going on through your mind? Did you imagine whether you would ever recover?
I can tell you, and I've told people. I didn't know there was medication, so I knew I was going to die, and that's why one of the reasons I shared my image, my voice. In my mind, I've seen people removed from the bed, or the doctors saying that we are going to put this patient in artificial coma. So in my mind, I had seen death. And I can tell people, at a time I was in a tunnel with a lot of pain, in agony. I was in a tunnel of darkness, and I could see my people I love very much are behind me, and me, I was walking in front. I saw death myself, and the experience was, because I did not have even connection with my family, I knew that I was not going home anymore. And in my mind, I was thinking, people here are not valid. People are being banned. People cannot be taken by family. So I have a lot of mind, and since I've lost my brothers and sisters, my brothers and my parents, I knew that it will be very hard for my family who are in Kenya even to get my body back home, and that was my biggest worry. And also my children, I have 3 children who are between the 23 and 20.
So what about today now? You are facing you are staring at death. How do you feel today?
Today I can announce that I'm healed from what I'm feeling. I'm still at home. I'm getting medications. I'm still getting some injection on the stomach to avoid the phlebit. I can say God has reached me where I am, and a lot of people prayed for me, plus the medication which the doctors have given me, and I'm healed. I'm healed, but I'm very weak because, being in intensive care unit, I've never been in hospital, but it's such an experience that I would not wish anyone to be in ICU, COVID-19 ICU.
And finally, Mr. Kenuthia, your wife and your family must be very happy to have you back home well.
Yeah, they are very happy, and because they had seen me when I was here before being admitted, and when I was admitted, they could not have access. You cannot visit people in hospital, so everybody is happy. They are tested, they are negative, and I thank God that I'm home, and to share this my testimony to fellow Kenyans who are trying to play some funny games, especially our youth who are being so ignorant. They don't take precautions or measures taken by the government, or even this don't care attitude or it's a wait and see attitude will not help anyone in Kenya.
Okay.
And yeah.
Mr. Kenodia, thank you very much indeed. You're a true ambassador of overcoming COVID-19. Thank you very much indeed for joining us, and we wish you all the best and total full recovery. Now, the fight against the spread of coronavirus is bringing to the limelight people who normally work behind the scenes in professions that are usually ignored. NTV's Sharon Baranga met some of those who work and are now on the frontline service.
Jared Nyairo is an employee of Foresight Company. He is stationed as a janitor at Nation Center. His work entailed cleaning of surfaces. Now, he is also tasked with sanitizing surfaces that people frequently touch, such as telephones, keyboards, doorknobs and handles.
Sisi huwa tunahakikisha haswa usafi unadumishwa hasa mara mbili haswa kwa siku kwa dawati pale penye watu wamekaa, na tuhakikishe sabuni ambazo tutakuwa tunatumia ama vieusi ambao tutakuwa tunatumia ni vya hali ya juu. Kumaanisha pale penye mtu ameguza tuwe tunapanguza saa katika meza, viuma za kufungua, milango hivyo.
The coronavirus can survive on stainless steel for 48 hours. It means door handles such as these are highly contagious. That is why people are advised to sanitize or wash their hands with soap whenever they come into contact with such surfaces.
Security personnel tasked with manning the entrance of buildings are also playing a key role in the fight against coronavirus, even though they have their own share of challenges from people who give them a hard time.
Watu wetu wakikuja maintenance na staffs, mara mingi tunawahimiza wana sanitize mikono. Wakiingia sehemu ya lift, utapata pia kuna askari pale anawahimiza na wafinyia lift.
Sometimes like visitors wanakuja, mgeni anatuambia I can't use your sanitizer because I have mine. Tukimuuliza ni kwa nini, anatuambia these sanitizers zimetengenezwa with so many chemicals. Yeye hataki kuchanganya hizo chemicals. Ikifika upande wa lift, tunakuwa elevators zetu zinabeba 13 passengers. So sisi kama security tumecontrol from 13 to 4. Of which these 13 wanakuanga crowded. Sasa vile tulipunguza wakwe wanne, hiyo inapunguza.
Tuzingatie sheria na maagizo ya serikali. Sababu sahi sanitizer iko kila mahali. Hata ukiwa kwa njia ukipatana nayo usipite, unanawa.
And they are not alone. People who arrange goods on supermarket shelves, as well as taxi drivers, are also at the front line in the fight to curb the spread of COVID-19. Sharon Baranga, NTV.
Now, Shadrach, if you're watching that, your job, people normally would just pass you by and not think much about you, but suddenly because of where we are at, you are now an essential service provider. Kama watu ambao walikuwa wanakupita, kama hawakujui, hawakusalimii, sasa inabidi kutambue kwamba wewe ndio unahakikisha usalama wao, kuwasaidia pengine kunawa ama kusafisha mikono. Hali imebadilika kidogo sasa, si kama zamani.
Si kama zamani kwa vile saa hii at least mahali tuko, naweza sema tuko na ile trust ya like us here at Nation Center. Whenever anyone sees us, anatutrust. Whenever we give directions, wale wanaingia wale wanatoka, they trust us and we are happy. For example, sanitization, like my employer company, they have been in the front line in the fight against this COVID-19. They've always been providing us with the face masks, the hand sanitizers, and we always ensure everybody mwenye anaingia, he must sanitize before getting in, and also such also we usually do, like us, we have very high machinery on the side of security, such we have scanners.
Na Shadrach, sasa nikuulize pia, kazi yenu mnaifanya mchana na usiku, na kuna vituko vingi ambavyo vinatokea hapa. Tuko katikati ya jiji la Nairobi. Ni visa gani ambavyo umevishuhudia, pengine purukushani, watu wakikimbizana na polisi, watu wakijaribu kukimbia nyumbani, pengine kafyu isiwapate njiani? Ni vituko gani ambavyo umevionao usiku?
Usiku naweza sema venye kafyu ilikuwa inaanza, kulikuwa na ile kukimbizana, askari wanakimbizana na wale watu wenye wamechelewa kidogo, chokora, but naweza sema currently by 7 the town is usually very clear.
Watu wameenda nyumbani.
Watu wameenda nyumbani. If any case ukispot mtu mbali, kama sio askari mwenzako, ni askari polisi. So
sawa,
movements usiku naweza sema kuna kuanga kumetulia kabisa.
Sawa, asante Shadrack. Mwizi, coming to you. Some of these are guys who we never paid attention to generally, security guards, receptionists and so on. Suddenly their jobs are in the limelight.
Yeah, I was actually just listening to Shadrack, and I remembered a piece that was done for us for the Saturday Nation by Dr. Joyce Nyairo. And she was just examining the evolution of the security guard. The security guard today is not just a man or a woman who sits there and kuangalia what you're carrying in your bag and all that. That has changed. The security guard right now is the one who is ensuring the safety and sanitation of employees and everyone else who was walking into a building. So they are not, the rungus are gone. Their choice armor now is sanitizers. I can't remember which building I went to, but I remember asking them, so why is it that now you're not even searching me? You're not checking whether I have any weapons as I go in? And the man told me, sahi hata Al-Shabaab wanaogopa hii kitu. So for them, really things have changed. And people have been talking about the new normal, what the new normal is going to look like. A lot of things will change. Even the way we view these people that we ordinarily ignore. Think about it. For a lot of people working in public offices, the man or woman at the gate is determining whether the guys inside that building are safe. So this person is really the frontline worker, frontline public health worker for the people inside. They are protecting you. They're ensuring that I've seen some organizations have deployed, other than the sanitizers, the security guards also have the handheld temperature guns. Mm-hmm. So that's really, really commendable.
And even in terms of making sure that they themselves are safe, I saw Shadrack there with gloves on, and
yes,
that they too are protected.
Yeah. Now, if you remember, how we got here, when we, for instance, had the first wave of terrorism, you noticed how the security sector changed. The guards were all over. All of a sudden, they appeared to be militarized. They started patting you down, checking handbags and all that. And people felt as if they were invading their privacy. That changed, and over time, we got used to it. So I suspect that in the near future, we'll also get used to the security guard with a handheld thermometer, checking your temperature before being allowed into any office, whether public or private. Yeah.
Okay, Mwizi, thank you very much indeed. Now, religious leaders, human rights groups have condemned the excessive use of force by the police while enforcing the dusk to dawn curfew last night, and called for immediate action to be taken on those found guilty. Victor Kiprop reports on the violence and brutality that greeted the first day of the curfew, even as the country entered the second day of an overnight curfew in order to curb the spread of the coronavirus in the country.
A few hours after Kenya entered only its second nationwide dusk to dawn curfew since independence, tens of Kenyans were nursing serious injuries from the violence meted upon them, ironically by the very same people who swore to protect them.
What we witnessed last night was totally unnecessary. Curfew measures were outlined, and yes, the public knows that by 7 p.m. they ought to have been in their houses. But we are facing situations that are beyond normal citizens. So for the police to really react the way they did, for us that's excessive use of force and it is unacceptable.
I would want to appeal that they approach it with a humane face and hand, because they too are our congregants, they too have children, they too have brothers and sisters.
It is extremely important at this time that Kenyan law and the international human rights standards are respected, not just in Kenya but all over the world. The police bear a responsibility and a duty to maintain public order, but also to enforce the law, but they can only use force when strictly necessary.
From journalists in their line of work, ordinary Kenyans heading home, to even defenseless women trying to cross the ocean using the ferry, the police forgot that the enemy was an invisible, highly contagious virus and went on a rampage, tear-gassing, beating and assaulting innocent civilians, in most cases defeating the sole purpose of the curfew.
In all these situations, we are supposed to be adhering to the Ministry of Health guidelines on social distancing. So when you force Kenyans to queue back to back, already we are staring at a very critical situation where probably the spread of the virus is taking place.
We also need to be concerned for the police officers that were involved in the operation yesterday. Very few of them, I don't think I saw more than 2 or 3 that had masks. None of them had gloves. Many of them were actually touching people.
The Independent Policing Oversight Authority, IPOA, says it is investigating the matter.
We have also engaged with the Cabinet Secretary, Minister of Interior and Coordination of National Government, Dr. Fred Matiang'i, who reiterated the importance of ensuring that the police oversight continues to protect Kenyans from police officers who flout the law.
Before Kenya begins enforcing a dusk to dawn curfew for the second day in order to curb the spread of coronavirus in the country, many Kenyans are already rushing to beat the 7 p.m. deadline. But given the brutality witnessed in the enforcement of the curfew yesterday, many are in fear of what is in store for those who will not be home by the time darkness falls. Victor Kiprop, NTV.
Okay, and I'm now joined on the line by spokesperson of the Kenya Police Service, Charles Owino, after seeing those pictures of what happened in day 2 of the curfew. Mr. Owino, good morning and welcome to Your World.
Good morning to you. How are you?
Very well, thank you. But not too well with the police. I need to ask you a couple of things. Maybe first of all, we have had, as if you were watching us, these complaints by people who are ferrying in and who are allowed to ferry in food into the city or across counties, and they get a lot of harassment at police roadblocks, even though, for example, that order issued by the regional commissioner in the Rift Valley says you should allow food to pass through. Police don't seem clear on what kind of documentation these people need. What would you say to that? Can you give us some clarity on this?
First of all, thank you so much. I think so far so good. The law enforcement officers have done their best to try and ensure that enforcement on regulations that were put in for curfew and restriction of movement in the counties of Mombasa and Nairobi, Kilifi and Kwale is still going on very well. The issue of officers of cases of transportation of food across the country and across the counties, I don't think we have gotten much complaints. Because I know there are a few people who are trying to violate, but in terms of food and in terms of vital items that are required, I think the movement has been quite smooth. But all the same, in event that maybe 1 or 2 police officers decide to be unreasonable or difficult for one reason or another, I think we have senior officers close to those particular areas. Even if it is Nakuru, we have the sub-county commissioners, the county commissioners, the sub-county police officers, the county police officers, and the regional police officers. So I don't think we need to get a lot of trouble, because if you, in one way or another, you get into trouble with a policeman within an area, then it is important to contact his immediate superior for clarification.
Now, Mr. Owino, what are the instructions to police at the roadblock? When they stop a vehicle that's legitimately ferrying goods and it's allowed to do that, what documents should they show to the police?
It's not an issue of documentation because food is food. If you're carrying food, if you're carrying vegetables, we'll be able to tell these are vegetables. So there isn't much that we will ask you to carry, unless you are a particular service provider that may. For example, now Nairobi is totally locked down, and for example, if you are a chemist running a chemist in Murang'a and you want to move from Nairobi to Murang'a, we will not allow you. Or if you are a doctor living in Kiambu, living in Nairobi, and you want to go and work in Kiambu, we will request you to get temporary residence in Kiambu.
But Mr. Wino,
just a minute. If you are a surgeon, for example, and you've gone to Nyeri for a particular duty to operate on someone, we'll allow you to come back.
Mr. Wino, you still haven't clarified my issue.
Yes.
And I'm saying this because we've received complaints. We have someone right now on the line who was on our program and is still on the line who ferries agricultural products to bring across the counties to Nairobi. The police have no clue what they need. So they face a lot of harassment. There are demands for bribes. What should the police ask for?
Why are you asking, why are you insisting that what should we ask for? If you are carrying food, it's food. If you are carrying cabbages, it's cabbages. If you are carrying maize, it's maize. What are we going to ask you for?
And if that person is taking back the truck empty, he has nothing to show, how will the police allow him through?
Definitely he passed that roadblock. Most of these roadblocks we have several agencies that work in this particular place. Like, for example, I'm sure about Mombasa. When you are leaving Mombasa or when you are leaving Nairobi and you are carrying food, we stamp on your document. And if you are going, we will stamp on your document that you got into Nairobi carrying food. When you are coming back, you will come back with the same document and we'll be able to tell you had carried goods across to the other side.
That's what I need clarity on. What are those documents that you're stamping?
But you have an invoice. You are going to deliver whatever you are going to deliver. You remember we had given instructions very clearly that, for example, if you are in a lorry, then the owner of the lorry will definitely put up an instruction that there's a driver and there are two conductors in this particular vehicle. And with that letter that you carry from the owner of the lorry is what we are going to stamp.
Now, just turning on to another issue, the pictures we played there obviously were in the early days of the curfew when the police used excessive...
Not early days. It was on the first day. Don't say early days. It was on the first day.
Even if it was on the first day, there was excessive use of force by the police. I think we're not disputing that. Now,
when you talk about police, you talk about 120,000 men and women in police uniforms, police officers. So when us as police, we don't, police officers take individual responsibility. We don't take collective responsibility. And you are aware that when this happened, immediately, just a minute.
Mr. Owino, sorry.
Listen to me.
Hold on, sorry. Mr. Owino, I want to clarify something. Excuse me one moment. I'm saying I get you that it's not the entire police force, but you have to speak, you speak on behalf of the good ones and the rogue police officers. That's why I'm putting these questions to you.
Yes, and that is why I want you to be very specific. Don't say police. These were individual police officers. And these individual police officers, we immediately took action on officers who misbehaved on that particular day. We interdicted them and we suspended them, and the process of discipline is on. Because you remember, individuals also have their rights. They'll defend themselves, but eventually the law catches up with you. So we did our part, and I don't think you've seen this again. And it baffles me if you keep on repeating the same, because I wonder, are you playing old steps to incite the public against law enforcement officers? Why would we keep on playing this if it happened on the first day and action was taken? Why would we continue doing that?
So you're saying it's no longer an issue at the moment with the police?
I'm not saying it is no longer an issue, but whatever you are trying to do is to incite the public. You are giving a wrong impression, not only within our country, but internationally to everybody else, to give an impression that the police are brutal. I'm saying this stands, COVID-19 is a serious disease, and it is only your police. These policemen are the ones that will enforce laws and regulations of the land. You are not going to get policemen from Rwanda or from Zimbabwe to come and do that. And if an incident occurs and action has been taken, we must respect that. We cannot keep on repeating the same, because
now, Mr. Owino,
if we do that, then we are inciting the public against the police, which is wrong.
No, we're not in any way trying to incite. We're seeking clarity, and it's because of the number of complaints we've received. Can I give you a personal example that happened to me last night as I was coming to the Nation Center here on Kimathi Street at around 7:45 p.m. I am authorized to come to work. I have all my IDs and documentation. And when the police stopped me right here on Kimathi Street, they came at me, two policemen and one policewoman, armed with whips and bits of hose pipes. Is this a standard issue equipment these days for the police, whips and hose pipes?
I cannot prove that. I cannot tell whether you are telling me the truth or demonstrating. But if it happens, that is not a standard regulation.
Sorry, I was not demonstrating by myself, Mr. Owino.
And you know that is not a standard regulation.
So are these standard equipment issued by the police? That's what I'm asking, the whips and the hose pipes.
Not, and you know that. It is not, and you know that.
I don't, because the police who came at me to intimidate me were carrying these whips. So I have no knowledge, Mr. Owino.
You know very well. You know, there's something I've always said, and I don't know why you are not getting me. If today we catch your child smoking bang, God forbid, would we deal with him as an individual or deal with you?
It's a matter for you, the police.
These officers work under us, we accept. And these officers are under very strict rules of discipline. So I always say that police officers take individual responsibility. If you find one or two police officers misbehaving, what I would actually demand, especially when you found them with the whips, and you are somebody who is quite informed and you have all our contacts, you just give us the contacts and tell us, in this particular joint, there are 4 police officers, they are carrying whips, and they are misbehaving. We will take action immediately. You need to support us. You don't need to wait and come to the studio to attack the police fraternity, 120,000 men and women. You need to contact us. You are informed, you have a phone, you have our contact. Contact us. If we fail to act, then you can blame us.
Mr. Owino, we celebrate the police when they do the right thing and we feature them on our programs.
And we've always done wonderful. We've done well for this country.
Now,
and that is why we feel concerned when you pick 1 or 2 cases which we can deal with and highlight it as if the world is coming to an end.
Okay, Mr. Owino, just a different type of question. The police and the security forces are now very vital in this, in helping to combat.
The police are very vital, whether there is disease or not. Police is very vital, very important.
Can I now ask? So the question I was asking, but is there a danger that the approach could you might militarize what is essentially a public health issue? It's not a civil unrest issue.
I can tell you for sure that this is a serious epidemic, and we are not going to compromise standards, especially health standards. We have a duty and we have a responsibility as the police to ensure that regulations that are put forward are adhered. And therefore, we are going to ensure that this is done, and nobody is coming up is going to manipulate us to tone down on enforcing regulations. But equally, what we will not accept is an individual police officer taking advantage of this situation to harass any member of the public. And we are very strict on it. And we have institutions that are also supporting us on this. So what you should support us on as much as possible is to ensure that you support us in identifying these officers who are misbehaving, either capturing them on video or whatever, because the Inspector General cannot be everywhere. Myself, I cannot be everywhere. The top officers cannot be everywhere. Members of the public are urged to support us. Almost everyone has a simple phone that we can use to capture videos. You remember we just had a case in Kilifi and a case in Kwale where an officer was captured picking bribes, and the members of the public passed the information to us. We have already sacked those officers. So I call upon every Kenyan, wherever he is, to be on standby, because this is a very important thing that we are, a very important duty to ensure that every Kenyan is safe from this epidemic. But what we are saying, if any officer is going to take advantage to mistreat any Kenyan, it is the responsibility of every Kenyan to support us, to support the management of the police. Capture as many as possible. We will deal with them, and that will help us. We are not denying that there could be 1 or 2 police officers misbehaving, but capture them
Okay.
Pass them to us, we'll deal with them.
Mr. A last question. The guys who escaped from isolation, have you found them? Have you arrested them?
So far, I've not been informed of any, but I suppose they cannot go far. We have to catch up with them. I don't know how many could have been arrested so far because I've not been in touch with the Nairobi area region commander to get to know the number. Maybe they have been, maybe they have not been. But even if they have not been captured, we are going to catch up with them. There's nowhere they can run to.
And finally, from me, we're all trying to deal with this pandemic, the COVID-19 pandemic. It's a really big concern for safety. But are we safe in the hands of the Kenya Police Service?
You are always safe. You cannot even be there safe at the studio without the police supporting you. So you are very safe in the hands of the police. Support the police. Give the police the best image, especially where police is supporting you. Where we are wrong, you have a right to highlight, but it is unfair to keep on highlighting what we have already dealt with.
Mr. Owino, I thank you very much indeed and for taking the initiative to call us up to respond to some of these things that we put out on our program.
Well up, but we require you to be patriotic and remember, we will always use our own policemen. The men in uniform in the Republic of Kenya are the ones we'll use. We are not going to import any policemen. Support those police officers, support us, but where there are cases of indiscipline, highlight them, pass them over to us, we'll take action. But remember, the love that you pass to your policeman is the same love that you'll get back from the police officers. Thank you.
Thank you very much indeed. Now, the first night of the curfew started in tears, chaos and injuries as police came down hard on those who failed to adhere to the rules restricting movement between 7 p.m. and 5 a.m. But amid all the chaos, Baringo Central AP Commandant Ibrahim Abachila endeared himself to the public after he chose a different tool for his night duties. Abachila was filmed assembling those who were caught past curfew time, and instead of beating them up, he decided to sensitize them about the killer virus before sanitizing their hands and allowing them to go home. Now, his humane side did not go unnoticed as Kenyans on social media praised him for his efforts, with the majority calling on his colleagues to borrow a leaf from him. Yes, we need more of those, and time for a break. We have a short break now. Thank you.
Basic protective measures as guided by the World Health Organization. Clean hands frequently with soap and clean water. Cover nose and mouth when coughing and sneezing with a tissue or flexed elbow. Avoid close contact 1 meter or 3 feet with anyone with cold or flu-like symptoms. If you have fever, cough and difficulty breathing, seek medical care early. Avoid raw or uncooked animal products. Help the world put an end to the spread of respiratory diseases by sharing this message with a friend. Message brought to you by Sour Herbal Family Bath Soap.
Discovered the world-famous Molfix and saw the difference. Let's see how absorbent Molfix is. Molfix, thanks to its ultra-absorbent particles, can keep more liquid than the other diaper brand, so you can use it comfortably all day long. All babies deserve a high-quality diaper. You should also try Molfix.
I want you on the Black Sea with your crew. Trans-Georgian Pipeline. The Corps has offered your services for site protection. Intelligence on the ground attribute attacks to an Afghan militant, Roshan Gazakov.
The MQ-1 Predator will be our eyes in the sky.
I think I'm seeing something.
Take the shot. Rampage! Rampage, take the shot! RPG!
Sniper is what we are. No hesitation.
We will win this war.
Heaviness and a burning inside, it could be heartburn.
Indigestion and heartburn?
Eno gets to work in 6 seconds and works on the 6 symptoms of heartburn so you can keep living life non-stop. Eno, fight heartburn and indigestion fast.
Okay, Sylvia, if you're still with us, I want to come back to you for a quick reaction. You heard my conversation with the police spokesman, Mr. Charles Owino, and you brought up the issue which I raised with him regarding those hassles at the roadblock. What did you make of his reassurances or his comments?
It was very reassuring to actually hear that, you know, as long as I have the evidence of food in my vehicle, I'm able to pass through the roadblocks. And I think for now, it's just a wait and see. And I'm happy that, you know, it's been highlighted on TV and people have seen that, you know, and even other farmers and people have seen that it's possible to actually pass through the roadblocks, you know, with your food and your vegetables or your fruits without being harassed in any way. So for me, I think it's just going to be a wait and see. And let's see how it goes in the coming days. But it was very reassuring to hear that, you know, we can actually get through and bring our produce without any harassment or being asked, you know, to produce any documentation. The only thing that I can quickly comment on is that it's still not very clear if I need any documentation. He mentioned about an invoice that you can have on your way back, but sometimes you also have to go with empty vehicles towards the farm. So it's still not clear if, you know, there's a specific documentation that we need. So I hope that we'll still be able to get across, get our vegetables and not be harassed in any way. But I'm happy to hear that and I'm quite assured that all will be well.
Okay, thank you. And at least the police were responsive to your complaints, and I'm sure you're speaking for many other people who have to do business across county boundaries. Now, let me cross over to Eunice Kagema. Eunice Kagema is a critical care travel nurse in Los Angeles, California. Good morning and welcome to Your World.
Good morning, good morning.
Now, give me a sense of, I know you're on the front line in California in this fight against COVID-19. What does your work involve?
Hello?
Hello, Eunice, can you hear me?
Yes, I can hear you now.
Okay, please tell me, what does your work involve?
Yeah, I'm a travel nurse, critical care nurse, and I'm involved with caring for COVID patients. What happens is that we are assigned to go to crisis centers, you know, hospitals. And that's where we see patients who are in a secured place, you know, unit. And these patients are coming in with acute severe respiratory distress. So they are getting intubated, ventilated, and so my care is all about taking care of them.
What's the situation in California at the moment with COVID-19? If you can hear me, just give us a sense of how are things looking at the moment as we speak in terms of this virus.
The virus is deadly as it is, because obviously you can see how many deaths we have experienced so far. And but we are asking people to take care of themselves. You know, wash your hands. You know, wear a mask if you can. And I mean, you wear a mask all the time. And prevent contact.
And in terms of infections, we just saw a report coming out this morning saying that actually the first case to have been confirmed positive, or was it the first death, that was actually in California back in February. What kind of precautions are people taking? What is the mood on the streets as you drive around LA, for example?
What is happening now is that everyone is taking care of themselves. They are all on the mask. Even when you're going to buy anything in the shops, you are not allowed to buy anything without the masks on. So everybody is on the lookout.
Have you sadly had to witness any deaths?
Yes, as a nurse. And sad to say that it's a deadly virus. And we're asking everyone just to take care of themselves. If you get a fever, it is just good to go get seen by the doctor, because what is happening, the fever is lasting for more than 2 weeks. And so when they come in, they have shortness of breath, they have muscle wasting, and all that.
Okay.
And again, because the mode of transmission that is droplet and contact, airborne route,
All
we
right.
need to just take care of.
Eunice Kagema, thank you very much indeed for joining us from LA in California. All the best in your frontline work. And Mwinzi, as we come to a close, you overheard the interaction with the with our police service. What did you think?
It's a bag of mixed. I don't know. I was listening to Mr. Owino, and he, being the policeman that he is, even his tone was menacing for us in the studio here. I understand that the police are working in very, very harsh environments. There are a lot of people who obviously are not obeying the orders given by the government. I think the question of whether we are running the risk of militarizing this war was also not well answered by the spokesman. But by and large, I think Kenyans are starting to wake up to the new realities that we are facing. We are at a place now where we don't know how tomorrow will look like.
Yes.
Yeah, we were used to waking up and knowing tomorrow I'll wake up and go to work. Now we are just sitting, and we are basically lame ducks, sort of. We have the frontline workers, and the police officers are part of that group. They are doing a lot of surveillance work. I know that part of the contact tracing team involves police officers. Mm-hmm. So we really cannot take that away from them. There are the rotten apples, as he said. But I think he's being a little bit unfair when he says that we should only talk about the rotten apples and not the police. I mean, every police officer is representative of the force, and if there are rotten apples, then we'll talk about the police, not just one person. He's also quite right when he says that this is not a battle for the police officers alone. It's a battle for everyone.
Yes.
So we must obey government orders. We must listen to the police officers when they are telling us what we need to do. And he has assured us that if we take necessary action, and we have proof, we have evidence of police misbehavior, and they record it,
they will take action.
They will take action, and that is quite reassuring.
Okay. Now, 300 drones were deployed on Saturday in a light show in China's southern city of Zhuhai, close to Hong Kong, to welcome home local medical staff returning from the front lines of the COVID-19 outbreak in Hubei province. Okay, great pictures there and use of drones in China. Now let's look at what you have been saying through our hashtag New Normal. It's a comment here from Josephat Rohio, who talks about extortion. That's all that comes to mind, extortion. And then Magunga Hesbon, you say traffic jam during midday hour, Then Engineer Pohi Macau, you say fear of the unseen. That's what's going on through your mind at the moment. Joy Obilo, now lack of PPEs at the workplace. These are the challenges that people on the front line are facing. We have a comment here from Ramadan Koskei, everything is not moving. And also from Magda Pitch, now they should carry askari ni binadamu. I saw bodaboda riders attack them on the third day of the curfew, nikiwa kwa building yetu kwa rooftop. I think it's better than carrying the guns because they are not out to kill, but out to discipline, obviously in reaction to what the police spokesperson was speaking about. We have another one here from Cosma Musimi. There are some very dangerous people there. If policemen are not vigilant, they will be killed in a minute. Okay, again, in response to that conversation earlier with the police. Dennis Martin Mutai, kwani unapiga corona ama ni watu? In fact, they need to be more careful because hata wenyewe havai mask in the name if wako kazi. The legend, the corona will start with you, my friend. You need to treat your fellow Kenyans as human beings for God's sake. So those are some of your comments. Keep them coming in. Hashtag new normal. You can also reach us on WhatsApp. We want your videos as well, your homemade videos, your discussions with your children, asking them about what they understand about coronavirus. Please send them in. And remember, we start our day at 6:30 in the morning with a fantastic hot workout. Tizi Nyumbani with professional trainers, 6:30 a.m. Monday to Friday up till 7 a.m. Using your home as a gym will guide you on that. So on behalf of all my guests and the entire crew and team of Your World, good morning, stay safe.